nothing can happen, nothing works. अगर हम लोग सोशल मीडिया को बम्बार्ड कर दें कि yes, it is the need of the hour, yes, screenings, early detections are the need of the hour, तो हम सोचिए हमारी ये वॉइस कहाँ कहाँ नहीं पहुँच सकती. हमें अपने आप को जागरूक तो करना है. Today is unless and until it is I care, there is no we care. Thank you so very much.
Powerful words, inspiring words. Alright, so now it's our time to start the symposium and actually talk about these things. हम बातें करेंगे, चर्चा करेंगे, वार्तालाप करेंगे, and we'll talk about ये SheShield जो है, shield का मतलब है कवच. तो कवच आप ये देख सकते हैं, कवच आप literally तो लगा नहीं सकते, but prevention and knowledge is the कवच today. In today's day and age, digital जब हर कुछ information आपके पास WhatsApp से आती है या digital media से आती है, the कवच is knowing about something and then taking action, preventive action on it. So our first session today, beyond mammograms, empowering early detection for lifelong well-being is crucial. Mammograms, while life-saving, are just one tool in a broader arsenal we need to deploy in the fight against breast cancer. Did you know that in India, less than 1% of women in rural areas undergo regular breast cancer screening? Today, we will hear about the importance of advancing early detection methods beyond traditional mammograms.
We're fortunate to have an exceptional lineup of speakers today, and the session will be moderated by Dr. Prakhar Singh, co-founder of Ospi Healthcare. We're confident that this discussion will offer innovative solutions that empower early detection, not only improving outcomes, but also saving lives. Let's take a moment to reflect on the progress we're about to witness.
I would also like to say that Dr. Nishita Trahan couldn't be here as she is performing surgery in Sunrise Hospital. So Dr. Prakhar will be representing Sunrise Hospital today, and you can ask any questions that you have to Dr. Prakhar today. Dr. Prakhar, we'd like to have you on stage. And I would also like to call the panelist, Dr. G.K. Rath. Sir, please. Dr. Harit Chaturvedi was also supposed to come here. He is also in surgery, and this is, I would say that duty calls का आपको जाना पड़ता है. I would like to call Dr. Anup Yadav. Anup ji. And I would like to call Dr. Mandeep on stage, please. Do we also have Dr. Tanuja here? Interesting. Some of the doctors are missing क्योंकि वो जान बचा रहे हैं. We'll start in 2 minutes because we also have another guest coming. He is the head HR of EXL. He works for a lot of women empowerment initiatives under EXL. So, Anurag is also, by the way, Anurag ji के नाम आप जितने बार सुनेंगे शायद आप उनका चेहरा नहीं देखेंगे because Anurag जी ने ये फाउंडेशन स्टार्ट तो किया पर वो कभी सामने आके अपना चेहरा लगा के क्रेडिट लेना नहीं चाहते. He is one person who is like, my work will speak for me. मैं काम से अपने कर्म से जब कोई इफेक्ट लाऊंगा सोसाइटी में, चेंज लाऊंगा सोसाइटी में, वो मेरा एक्चुअली परिचय होना चाहिए. सो समटाइम्स यू सी दैट अनुराग जी इतने बार मेंशन होते हैं बट वो आते नहीं है, इज बिकॉज ही डज नॉट बिलीव इन एक्चुअली बीइंग एट द फोरफ्रंट, ही बिलीव्स इन पुशिंग फ्रॉम बिहाइंड. सो Dr. Prakhar, if we could start at least chatting. Mic, long press on the mic. Hello.
So, very warm welcome to all the dignitaries of the dais and all the dignitaries of the dais, and very warm welcome to everybody who's taken out time to attend this conclave and support us in our cause for evaluation and eradication of cancers, especially the females of the country. So we have on the dais with us eminent oncologist from India. Sir needs no introduction. Sir has been the head of department for radiation oncology in Delhi, and Sir is the stalwart. And I've seen Sir through the ages, guiding most of the oncologists, and I'm sure Sir will agree that he has encouraged countless oncologists throughout his career. So, Sir is also Sir's student, and Sir also is the head of oncology at CK Birla Hospital, and very eminent oncologist. And today we have Sir Dr. Anup Yadav Sir also along with us, and Sir also has been a forerunner in providing the foundation for cancer research in India. Now, so we are missing Dr. Nikita Trehan today and Dr. Harit Sir. I've been Harit Sir student in Max, and they both are occupied in surgery, as we probably know. But we will definitely take this session forward. And Sir, if I may ask you, what is your take on, let's say, when you are dealing with because you have seen, the government setup so closely throughout your career, what is your take on the availability of cancer research and, the evaluation facilities in the country?
मैं ऑलवेज बोलता हूँ, मैं पिछले 50 साल से एम्स में हूँ. 73 में उड़ीसा से MBBS किया, पिछले 50 साल से एम्स में हूँ. मेरा एक्सपीरियंस है, अभी सबसे बुढ़ा आदमी मैं ही हूँ. ऐसा है, मैं जिस कंटेक्स्ट में बोल रहा हूँ उसको पॉजिटिवली लीजिए. कैंसर इज ए फैंटास्टिक डिजीज. कैंसर से बढ़िया कोई बीमारी नहीं है. मैं इसलिए बोला क्योंकि हम लोग मास्टर है. मास्टर मतलब कुछ ऐसा बोलते हैं जो अंदर जाए, ये नहीं कि कोई बोलते हैं कोई गूगल करते हैं. इसलिए बोल रहा हूँ, आजकल जो कॉमन डिजीज हमें फेस करते हैं वो है डायबिटीज, बीपी, थायराइड, कैंसर. ये डिजीज है. डायबिटीज ना ठीक होता है ना प्रिवेंट कर सकते, नहीं कर सकते. कंट्रोल जरूर होता है, लेकिन लाइफस्टाइल डिजीज है. आप किसी के घर जाइए, ऊपर साल आप साल में थोड़ा. बीपी भी वही बात है. कैसे बीपी प्रिवेंट करोगे? डेली बीपी लोगे, बदल होगा. थायराइड भी वही चीज है. लेकिन कैंसर ऐसा है, इट्स ए गुड पॉजिटिव वे में ले. 50% प्रिवेंटेबल है. 50% कैंसर प्रिवेंटेबल है. डायबिटीज 0%, बीपी 0%, थायराइड 0%. प्रिवेंटेबल हो सकता. मैं अभी बैठे बैठे बताना चाहता हूँ, लेक्चर तो बाद में लूंगा. हमारे पंजाब एक बढ़िया स्टेट, वहाँ लोग ना सिगरेट पीते ना पान खाते हैं. मैंने पिछले 50 साल में किसी पंजाबी को मुंह का कैंसर नहीं देखा. बाकी जो है वो बाद में बात करेंगे. तो हमारे कंट्री में प्रूव है टोबैको रिलेटेड कैंसर 35%. एंड क्योंकि ये SheShield कंसेप्ट है, जो नेक्स्ट प्रिवेंटेबल कैंसर सर्वाइकल कैंसर. मैं आज सुबह जितने लोगों को मिला, पूछा तुम्हारा बेटिया है क्या? 2-3 लोगों ने हाँ बोला. मैंने उसको पूछा, भाई आपके बेटिया ने वैक्सीनेशन लिया? बोला नहीं. बोला क्यों नहीं लिया? ना पता नहीं कि कोई बात. 2 ही लोग बता सकते हैं, एक तो जर्नलिस्ट और दूसरा डॉक्टर्स, जिसके घर में 9 से 14 साल का लड़की है, वैक्सीनेशन नहीं लिया और मेरे पास दोबारा अलाउड नहीं है. जो स्मोकिंग करता है अलाउड नहीं है. आई डोंट केयर, बिकॉज जो मेरे बात सुनता नहीं, फिर आएगा क्यों? Cervical cancer is a preventable disease. कनाडा, ऑस्ट्रेलिया, स्वीडन में खत्म होने वाला है. तो वैक्सीनेशन 2 ही डोज तो लेना है. लोगों को पता ही नहीं क्यों कोई इंजेक्शन क्यों लेना जब मेरे पास बीमारी नहीं. तो टोबैको रिलेटेड कैंसर एंड सर्वाइकल कैंसर का प्रिवेंटेबल डिजीज. क्यों? पिछले 50 साल से मेरे करीब 50 साल मरीज हैं जो ठीक हो चुके हैं. कुछ लोग हैं ठीक हो चुके मतलब वो कैंसर से नहीं मरेंगे. हम मरेंगे तो जरूर, कैंसर से नहीं मरेंगे. कुछ लोग ऐसा है जो ऑलरेडी अपने को बता चुके हैं. मेरे डियर प्रेसिडेंट है मनीषा कोयराला, आप जानते हो, मेरे साथ काफी जगह जाती है. हमारी बात तो सुनते हैं लोग. हम जो बोलते हैं 50% नहीं सुनते, पर जब फिल्म एक्ट्रेस या कोई सेलिब्रिटी बोलते हैं, मैं यही बच्ची क्यों एंड सी द ग्रेट प्रोपोनेंट ऑफ कैंसर केयर. सो मैं ये बताना चाहता हूँ कैंसर इज ए वेरी गुड डिजीज बिकॉज इट्स प्रिवेंटेबल 50%, प्रिवेंटेबल early diagnosable 50%, curable, total cure 50%. Thank you.
थैंक यू सर, थैंक यू. ये बहुत ही जेन्युइन बात सर ने बोली कि अगर कोई अपना ख्याल नहीं रख रहा, जिसको पता है और फिर भी वो अपने अपने आप को एक इस अंधेरी नगरी में ढकेल रहा है, तो उसको क्या ट्रीट करना है? ट्रीट हम सिर्फ कैंसर ही नहीं करते, कैंसर के साथ पेशेंट की मानसिकता को भी ट्रीट करना बहुत ज़रूरी है. एंड दैट इज आई थिंक वेरी इंपॉर्टेंट. जो सर ने बोला कि वैक्सीन लगवाओ, स्मोकिंग मत करो, चाहे कितना भी कोई हम प्रमोशन कुछ भी करें, इट ऑलवेज हैज टू हैव अ डीपर इम्पैक्ट नॉट ओनली ऑन द डिजीज बट ऑल्सो ऑन द साइकोलॉजी ऑफ द पेशेंट. सर इफ आई मे आस्क यू, आप तो इतने टेक्नोलॉजिकली एडवांस्ड एनवायरनमेंट में हैं, सीके बेड़ा इज वन ऑफ द वेरी गुड सेंटर्स. हाउ डू यू फील दैट टेक्नोलॉजी इज चेंजिंग कैंसर अवेयरनेस नाउ?
Awareness, obviously, बात करते हो टेक्नोलॉजी की, तो डिजिटल AI, everything is coming forward. Luke is here with me. They are coming up with a scan. You can a preliminary scan. The AI can read and let us know whether there is a cancer or not. I was in US last week, so they are coming up with a blood sample. I think it's just a matter of time. Within 5 years, we'll be having a blood sample to detect cancer at a register. So things are being innovated, but obviously all of this comes at a particular cost. And yes, there are certain things which we can get from the West and put it up for India, but there are certain things which we should devise for ourselves. That's definitely said. Cervical cancer vaccine, I would like to congratulate the government for getting it in as an Indian cervical cancer vaccine. The cost are dramatically reduced. Cervical cancer vaccine का एक important चीज और है. Oropharyngeal cancer भी prevent करता है, थोड़ा सा penile cancer भी prevent करता है, warts भी prevent करता है. So that is important. So all these things are very important. Just a small vaccine can make a lot of difference to us. And I have Shalini sitting with me in the background. So this is another, I think they'll present. This is an Indian solution for breast cancer. So obviously you actually find that India में breast cancer is a younger age group. The Delhi NCR data है वो 45 is the peak age of incidence. जब मैं 45 पीक एज ऑफ इंसिडेंस की बात करता हूँ तो मुझे स्क्रीनिंग 30-35 पे शुरू होती है. मैं 30-35 पे बात कर रहा हूँ तो वहाँ पे स्टैंडर्ड तरीका मैमोग्राम्स वगैरह आर नॉट इफेक्टिव एंड एप्लीकेबल बिकॉज ऑफ द यंगर एज ग्रुप, ब्रेस्ट डेंसिटी, साइंस में इज डिफरेंट. एंड advocating self-breast is something which we should all do. It is said that a woman who does self-breast regularly can detect a lump of 2 centimeters, which is a stage 2, stage 1 cancer. Clinicians who can do regular checkup with clinicians, they can detect a lump of 1 centimeter, which is again stage 1. And this that concept is in which we have empowered visually impaired females. As you can understand, if somebody is visually impaired, the touch becomes better. So one inch is data, 2 inches data. And when they examine breast, they can detect a lump of 0.5 centimeters, that is 5 millimeters. That is how amazing it is. And this is something important to understand that हम कभी भी handicap को ऐसे देते हैं कि
I would like a handicapped man to be a person to be at par with myself. उसको लैपटॉप नहीं चलाना आता, उसको गाड़ी नहीं चलानी आती है, तो गियर चेंज कर लो, ये कर लो। ये एक ऐसी चीज़ है जो हम लोग नहीं कर सकते, या हम लोग कर सकते हैं, बट हमसे बेहतर ये लोग कर सकते हैं। And again, this can be a vocational avenue or not a blind women in it. It can come out as a vocational avenue, and it's just not a vocation. They would be actually serving to prevent breast cancers or cancer at early stage. And as Dr. Kaushik rightly said, man gets cancer in the household, it's a financial impact. When a woman gets cancer, 3 generations get away. That is not important. Thank you.
Thank you so much, sir. So I would also like to introduce our two new guests on the stage. We have Dr. Mrinal Pandey. He is a retired APS and was the APS to the Ministry of State of Health, and also is a very prominent leader in the media and the health industry. So sir, I would like to ask you one thing. आपको क्या लगता है कि मीडिया का कितना रोल है अवेयरनेस जनरेट करने में, ट्रीटमेंट्स को लाने में, और कैसे वो पॉलिसीज मॉडिफाई करती है?
मुझे ऐसा लगता है कि मीडिया मीन्स अवेयरनेस, एंड अवेयरनेस शुड बी फॉलोड बाय सेंसिटाइजेशन. वी आर टॉकिंग अबाउट प्रिवेंटिव स्टेप्स फॉर ब्रेस्ट कैंसर. तो इसमें अब आजकल क्या है, जो ट्रेडिशनल कंसेप्ट है मीडिया, आई कैन टॉक अबाउट दैट. अर्लियर देयर यूज्ड टू बी प्रिंट कास्टिंग. Then we talked about TV casting, and now we are talking about social media. We are talking about convergent media. तो मीडिया जो है, it is going to impact our lives. जैसे हमने अभी एक फिल्म देखा है, इसका ड्यूरेशन 7.5 minutes. This film has told a lot of stories to you. इसका इम्पैक्ट हुआ, लेकिन अगर हम 70 मिनट आपसे चिल्लाएं, ये करना है, वो करना है, इसका इम्पैक्ट उतना नहीं. जैसा कि आपने एक चीज बताया कि when Manisha Koirala talks about cancer, that this may be cured, it will have more impact on you. But he says something in his individual capacity, it will have no impact. तो मीडिया के साथ सबसे बड़ी अभी चीज हुई, मैं अभी 3 महीने के लिए यूएसए में था, और वहां मैं कैंसर के पेशेंट से बैठा. वेरी इंटरेस्टिंग थिंग दैट आई शुड लाइक टू शेयर विद यू. एक मुझे लेडी मिली और उन्होंने कहा कि पांडे साहब, यू हैव कम फ्रॉम इंडिया, एंड व्हेनेवर यू कम टू मीट मी एंड यू आर टॉकिंग टू मी फॉर 2 hours, it has a healing dimension, because I am talking about a lot of good things. And she is alone. And when you are alone, this is not a dangerous symptom. But when you are suffering from loneliness, it is very alarming. Because loneliness is the first sign of depression. So I made a thorough study of the mindset of that lady suffering from cancer. She told me, Dr. Pandey, as a result of your 3 months interaction with me thrice a week, I have already made a tramp over my nightmares due to new dreams. And now she has transformed hope into optimism. तो क्या है, आप दिमाग में आपको कोई देखने आता है, क्या डेवलपिंग सोसाइटी में मीडिया का एक बहुत बड़ा रोल है, ओरिएंटेशन है. हमें कोई देखने आता है और उसमें अपने रिलेटिव्स हैं, सबके पास फाइनेंशियल लिटरेसी है, एजुकेशन लिटरेसी है, सोशल अवेयरनेस है. एक आदमी का रिएक्शन मेरे पास है, पांडे साहब आप बड़े दुबले दिखाई पड़ रहे हैं, अरे आपके तो हेयर्स जा रहे हैं. मुझे लगता है कि यहाँ पे मीडिया हैज ए ग्रेट रोल टू प्ले from the angle of awareness and sensitization. If you are going to meet a patient suffering from breast cancer at the earliest stage or advanced stage, what should be your way of communication? How you are going to gossip? And you should keep in mind that if you are going to talk with that patient, you can heal their wounds in a wonderful way. तो यहाँ पे ये जो मूड ऑडिटिंग है, देखिए मूड ऑडिटिंग ये होती है कि हम पेशेंट्स के रिस्पॉन्स और रिएक्शन को देखते हैं, उसके डार्क साइड को अगर हम अधिक नर्चर करेंगे तो उसके भीतर डिप्रेशन होगा और दवाइयाँ काम नहीं करती। अभी नली कमरनी जी चली गई, उन्होंने एक बात बोला कि स्पिरिचुअलिटी एक ऐसा साइलम है जहाँ सारे लोगों को रेफ्यूजी करके आना पड़ता है और स्पिरिचुअलिटी में पावर होती है। उसी तरह हम किसी के पास जाते हैं, अगर पॉजिटिव टॉक करेंगे तो उसका इफेक्ट बहुत बड़ा होगा। मुझे लगता है कि जो WHO की रिपोर्ट है 2022, I should like to talk about that. They are saying that across the globe annually the breast cancer is increasing at the rate of 1.4%. But India, this is to the tune of 1.7%. And the annual death is roughly 90,000 or more in India, roughly. And all the detected cases of breast cancer are to the tune of 2 lakh plus in India. But the figures are not alarming because Dr. Rath is also the harbinger of new hope, and he has talked a lot about so many patients who suffered from cancer in a very advanced stage, but today they are alive. So I shall not talk about these data and figures. This thing is not important, but one thing is important, that October this month is dedicated for raising consciousness about this breast cancer, and this October is very important. And how this conclave is important, because it is going to foster the sense of oneness, the sense of unity, and this conclave has given us a platform where all the stakeholders are joining hands together. Medical experts, researchers, sociologists, media friends, healthcare workers, and so many other, this kind of medical fraternity, friends, they are here. So I think it is a wonderful platform, and media can play a wonderful role through making short films in a series, and it should be shown to the audience for creating greater awareness. Thank you.
I would also like to welcome our eminent guest, Mr. Gopal Rajvanshi. He is the Vice President Human Resources for EXL Technologies. And what I would like to ask you, sir, is what do you think, as a corporate, it can be done for the employees as a benefit that you see for healthcare? Because today a lot of corporate wellness is coming up. People are building AI-based apps, building health tech startups who are coming up with corporate wellness plans. What do you think is the implementation that we can have?
Thank you very much. And first of all, I'd like to thank Anurag for getting me here. I think it's such a noble cause. Cancer, particularly, is close to my heart. I lost my aunt 18 years ago, and she passed away right in my arms. So it's very close. I'm very passionate about the awareness for the cancer. However, making the situation a little lighter, because all of you are here. I would like to talk about a little bit about my past. My parents have been associated with the Rotary Club and my mother with Mediways for the last 50 years. And both of them have been the past presidents of Rotary as well as Mediways. So I understand thoroughly what Mediways does. I've grown up rather in that environment. This is the second time I've been with a room full of ladies. The last happened about 27, 28 years ago. And I am a hotel management graduate, by the way, from Bangalore. And that time Mr. Sanjeev Kapoor was very, very big. So there was a show and I was a chef actually in the past. So he hosted a show in Taj, Bangalore. And we were very young and like student. So 4 of us thought we should go and attend. And we took a pass. It was 500 rupees, I still remember. It was a lot of money that time. So we took the pass and we were very happy and we were in suits that we should go and attend and we'll see him, etc. Then we entered the room. It was all ladies. Beautiful ladies like you. And we were like shocked. However, since we were there, we attended, it was wonderful time and we learned a lot from that. Coming back, what I do as a part of my job in DXL is I look after the capability development in HR. Also, I manage the corporate wellness and diversity and inclusion for the organization. And we've taken a lot of measures, particularly in corporate wellness as a part of our organization. Sir spoke about the mental wellness and being alone in the time of crisis. And it is not only cancer, it could be any kind of crisis which people have gone through or are going through. You don't know what you see, you don't know what's happening. And we firmly believe in that. Of course, the startups, technology, etc. will continue to play the role. I think it's for the better for everybody, particularly the Nura thing which is there. Nura, I've done this training for myself as well, including my family, and I think it's a wonderful initiative, and I congratulate even Anurag to introduce me to this, and we've rolled out this to all our employees in India, which are about 28,000 people in India, and with a discount package which Anurag is making to us. Now, what I feel particularly, so there was one comment which I heard from one of our eminent speakers that women is under the command of the husband at some part of life. I would like to disagree with that. Totally, and I'm sure all of you will do that. In today's age and era, I don't think any woman or is undergoing through that. But yeah, I understand it. Small towns, villages, etc. We still have that culture, and I think there is a lot of need to spread the awareness around that. And to your point, there are a lot of new inventions or innovations which are happening for the betterment of our society. So I think we should avail all of that and we should go for that.
Thank you, sir. Thank you so much. And Anup sir, continuing with you on the part of the innovations, if you can throw some light on how AI is helping us to develop the better stages of cancer screening.
Yeah, definitely. So I'll give you some examples. First, let's talk about why you need the screen. So it's a simple thing. If you diagnose any breast lesion as stage 1 and stage 2, so a simple surgeon can do the surgery. You don't need a high-end surgery. You can preserve the breast. You can preserve the same. And the cost will be around 2 to 3 lakh in India. If you diagnose the disease as stage 3, then you need the chemotherapy, radiation therapy, and a high-end breast onco surgeon like Dr. Mandi. And then the journey of the treatment is around 3 to 6 months. In stage 1 and 2, it's just a 1 or 2 week thing. If you diagnose a patient at the stage 4, then your journey will be around 6 to 9 months, and the treatment cost can go up to 20 to 30 lakh, and out of that only 30 to 40% people will survive. So I think that's a significant change in the number of lives we can save with the screening. So let's talk about the recent treatment screening modalities which are available for breast cancer. So first I'll go with the mammogram. It's a simple breast X-ray with very minimal dose of X-ray so that you won't get any harmful effect on your body. It's recommended after 44 years of age. If you are not happy about it or you say, I don't want to get exposed to X-ray, then you can go for ultrasound. Ultrasound use the ultrasonic waves which don't have any harmful effect on your body. So that's a simpler one and safer one. Then now in Indian researchers and even doctors have come up with a thermogram. It's an infrared camera which can differentiate the temperature sensitivity in the tissue. So that is one of the modalities, and that also don't have any harmful effect on the body. The most simplest one is, because when I was in my medical college, most of the patients with the breast cancer, they presented to us with the history of, I was taking a shower, I noticed a lump. So there are lots of YouTube videos which are available, so you can learn how to examine a breast. So you can do it once a week or once a month. So you can do it by yourself, and you can find out any changes in the breast, change in the shape, change in the size, or even any nodule is palpable. The fourth one, if you're doing self-breast examination and if you feel I am feeling something but I am not confident, so you can go to a medical expert or even a surgeon. They can examine for you. And one of the new technique, I was part of a study under Dr. Mandeep Singh and C.K. Birla. So we have compared ultrasound and mammograph sensitivity with the tactile examination of a blind woman. So the result was equally vocal. Like if you do an ultrasound or if you allow a blind girl to examine you after training, so the findings were similar. So now few of the hospitals, I think last time I was here, to Narayana Hospital started hiring blind women for this tactile examination. So I think these things are something which is changing the whole screening industry. Now let's come to the AI, artificial intelligence in breast screening, and even the Neura, how the Neura changing the patient journey. With Neura, they have uploaded 20 million images in their system, so they can detect a breast lesion 2 years earlier than mammogram, even ultrasound. So that's a significant time. If you detect something at 1 or 2 years earlier, then there are scarless surgeries for breast, which is available, very minimal cost, and just 2 days recovery. So these are the things which can change the patient outcome. Second, we need new innovation for new humans. Let me define new humans for you. The people who have sedentary life, they just go to their car, then they go to office, then they walk from office to the parking to the office. Second, they have more mental stress than physical stress on the body. Third, they drink in the night and next day they get hangover, they book the preventive test. You get the report by evening, please check it, do I have any problem? Because they have lots of anxiety about their health. So, the problem with the current screening is that every organ have a different screening program. Like for the breast, you need to do mammogram. For cervical, you do colposcopy or pap smear. Then lung and GI, they don't have any proper screening program. For coronary, they are doing colonoscopy. And there are few cancer markers which you can check. So, best part about Neura is that they are scanning your breast with the mammogram, low dose. Then they are scanning your chest. They are checking the lesion in the lung. Also, they are checking the calcification score in the heart. So they can predict you, are you prone to the heart attacks? If you have a calcification score, calcium deposition around your vessels, so that can predict you need a cardiology intervention and lifestyle modification, otherwise you are going to get the heart attack in next year. Same in the abdomen also, they are scanning your pancreas, colon and everything. Along with that, they are doing all the cancer markers with it. So you are getting the visual picture of your organ, along with that the markers. So that's the best part about this. And these new lifestyle is very hectic for everyone. The working culture and everything. So you can't go for 5 or 6 screening a year. So this is one of the screening which have cumulative all the information and all the organs through the AI, exposing you to minimal radiation and give you more information. So I can go for one day, I can spend 2 hours in a center, but I can't book 4 or 5 screening programs throughout the year. So that's a differentiator for our future journey. So I hope you all will come forward, motivate people, because if we start investing in Neura now, this will be available to underprivileged also in the coming years. It's all about demand and supply. Thank you.
Thank you, Dr. Sir. Sir, if we can have you on the dais so that you can let us know about your journey through the
I am grateful to the organizers, particularly Ganuranti, to follow me over here and share my experiences. And as I told you, I repeat, cancer is an excellent disease to prevention. It can be totally prevented. But breast cancer cannot be prevented, but God has given another mechanism to cure it almost 99 to 100%. In our own institute in AIMS, I have treated 50 women, out of which 49 are okay. 49 out of 50. And to tell you, we have treated 30 men with prostate cancer, all 30 are okay. This is our experience. I can tell you the names individually, cannot tell publicly. I told Manisha's name because she traveled with me to various places. अगर हम बोलते वैक्सीनेशन लोग बोलते तो डॉक्टर ने बोलता लगता है, नहीं बोलते. But Manisha बोलती है, Manisha और अमिता बोलते हैं, तो people have it, they have appeal. So we travel to various places and we vaccinate tens and thousands of ladies. Breast cancer is almost 100% curable if detected early. And now the incidence, you just heard, Pandey speaking, that the incidence of breast cancer is increasing. Cervical cancer incidence is coming down, but breast cancer is increasing. But there is nothing to be worried about that. Because breast cancer is more prevalent in the elite society. मैं आपको अपना जो इंडिया का फिगर बता रहा हूँ, मैं कैंसर रजिस्ट्री प्रोग्राम का चेयरमैन हूँ. हमारे these are figures which are available in the National Cancer Registry program. You can go to the website. I'll tell you. बारसी करके एक गाँव है, बारसी in महाराष्ट्र. वहाँ की incidence is 10 per 100,000. दिल्ली, बॉम्बे, कलकत्ता, मद्रास में 40 per 100,000. US में 110 per 100,000. बड़ा क्लियर है. जैसे आपका सोशियो इकोनॉमिक स्टेटस बढ़ते जा रहा है, we have, good or bad, that is not for me to decide. Your age of marriage increases, age of having the first child increases, less of breastfeeding. But these are not causes, these are the associated factors. You can't avoid that, you can't avoid progression. But as you just heard, speaking, Mandeep will tell you better, this palpation of the breast is one of the simplest and no expense involved. And he will tell you about a study which was just mentioned now by the palpation by blind women. And it has been found that their sensation is better than ours. So this is the least expensive technique for early detection. And the topic which has been, I'll talk to my topic also which has been given to me, that what are the innovations in the treatment. And I'll tell you some innovation in the diagnosis also. Why we require innovation? We have been talking of innovation since morning, because if you don't innovate, we can't diagnose early. You see, we are seeing now electricity not going since last 2 hours or so, but if you see 50 years back, electricity कब आता है पता नहीं चलता. Innovation, science, technology, and we are all progressing, and we are not far behind others. Let me tell you, the breast cancer in females, worldwide, the breast is the commonest cancer. Even though